hospital, we went to Seva organization in Gujarat, Self-Employed Women's Association. So we recruited 50 girls from there. And when I went to Coimbatore, all these girls were in nice blue sari, and they were walking the old patients and saying in Tamil, Vanga. It was nice to see a Gujarati talking in Tamil. So they'll be trained for a year or two to how to take care of these poor patients affectionately and passionately. So they are all now ready to take care of Anand, Gujarat. Similarly, we already trained 40-50 paramedical staff to take care of Shimoga. So we are scaling in India. We need to hire more people because eventually we hope to perform million surgeries by the year 2020. So we need to do more scaling in India. It's an amazing work they are doing. They are feeling the pressure, and we are pushing them hard too. Next, we are ready to announce 2 more hospitals, which I can mention at the end of the event. Yeah.
Dear listeners, we are talking to Murali, who is one of the founders of Sankara Eye Foundation, or gifting vision to poor people and performing surgeries, and they do have a couple of hospitals in India. And we are talking to him on the occasion of their completion of 10 years of service to the community. So Murali, tell us about, we talked about the infrastructure, right? Supporting infrastructure. How about the doctors? So are these doctors 100% employed and for Sankara, or do you just also get some experts from other places?
Yeah, that's a very good question. Sri, Dr. Ramani, Dr. Radha Ramani, they're all voluntary. They are providing their time free. Similarly, Dr. Ramani said there are several consultants, 75 doctors, who give maybe, for example, heart surgeon. For example, when you bring patients, poor patients, they may have some complications. At the time, you need to bring in the specialist to take care of them before you do the surgery. So they also have, Dr. Ramani said, they have 75 consultants giving time, maybe a few hours a week, few hours a day, like that. Our regular staff who do the eye surgeries day and night, they are paid very well. We want to keep them happy, and that's one way to attract good talent. For example, our Dr. J.K. Reddy, he's one of the best pediatric ophthalmologists in the country, and he's been there for 10 years. He's based out of Coimbatore, but he also goes to Bangalore and Guntur to do special surgeries. We just hired one of the best retino specialists in the country. So we have really top-notch quality doctors. And it is a challenge. Dr. Ramani says it is a challenge because we need to keep training more paramedical staff and doctors. So Bangalore is also going to be a training center. One of the key factors of the Bangalore hospital is it's going to be a training center, hopefully training paramedical staff and also doctors to take care of this huge mission we have.
Sure. Yeah. The other question is, one of the very important things is the post-operative care. It's not that you identified people who have got the vision problems. So you bring them and then perform the surgery, right? And there is a lot of things that happen after that as a post-operative care. They have to make some frequent visits and things like that.
Yes.
So how are we doing this?
Oh, that's a wonderful question. You have done your homework, Sri. Dr. Ramani said one of the differentiating factors in our hospital is the post-operative care, because most of these patients are poor patients, and after the surgery they really have to take care of their eyes very well, hygienic conditions. So what we do is we train them very well, and we also go to the patients at least twice in the next 12 months, making sure they are following proper procedure and hygiene. That's what gives us a 98 to 99% success rate. That's one of the key factors in our hospital. After surgery, we don't say that we are done, our job is done. No, we want to make sure the surgery is successful. That helps the hospital as well as the patient.
Definitely, thank you.
Yeah.
Now, you also have won an award very recently. Can you please touch on that?
I just got news from India yesterday. It's going to go out on our web soon. Our hospital has been awarded the best in diabetic retinopathy by Asian Hospital Management, and Dr. Radha Ramani, the founder, and Dr. Ramani and Dr. Radha Ramani just went to Philippines and got the award in person. It's a very, very proud achievement, which will help build the credibility of our hospital.
Definitely on the service that you are doing, right?
Yeah,
That's very nice. Okay,
yeah.
Good.